Well said. Do you think, in looking at fellow physicians and other healthcare providers outside of the hospital setting, they should be wearing masks during interactions with patients?
Well, anytime they're interacting with the public, I think it's a good idea. And in a era where so little is still known about this virus and the wide range of clinical outcomes that we're seeing for people of all ages, let's look at this newly described multi-system inflammatory syndrome for kids. I mean, that has really surprised the whole medical community, and no one would have anticipated that even several months ago. So I think in a situation like this, being as cautious as possible, being as humble about the science as possible, and then being as aggressive as possible on the prevention is the only way to go until we have a cure and an FDA-approved vaccine.
And do you think healthcare providers should be actively counseling their patients on COVID-19 safety protocols?
Yeah, this is the public health issue of the day. And so one outcome of this whole very difficult period is everybody now understands how important public health is. I got into this field a number of years ago as one who had trained in multiple fields because I saw too often where prevention was overlooked and people died too early and too young. And that agonized me. And I saw that the solution to that was a public health message. So that's how I got involved in this very, very fascinating and very important field. So the message now is the importance of prevention, and that's where everybody can make a contribution. This is where following the policy guidelines at the state and federal level is critically important. I like to say that when prevention works, absolutely nothing happens except for the miracle of a perfectly normal, healthy day. And I know that everybody would love to see the miracle of a perfectly normal, healthy day sooner rather than later. So that's where prevention is so important right now.